At first glance, this could be mistaken for just another weekend party. But behind the dancing and laughter lies a deeper purpose: mental health awareness. The event, organized by Geraldine Opoka and her team, seeks to redefine how mental health support is perceived and accessed.
We also wanted to put it in an environment that allows us to connect with one another in a setting that is different from the usual. We're sitting on the ground, we're sitting on mats, on cushions, we're mixing with one another and connecting, listening to stories, and that takes away the edge that is negative in the conversation around mental health, allowing people to speak, allowing people to be seen, to connect with others, and to heal, because it is through social connections that we heal.
Mental health challenges often lead to isolation, but gatherings like this provide a safe and supportive space where people can open up without fear of judgment.
We all experience sadness, we all experience fear, we all experience anger, as anyone else. It's what makes us human beings. So for the men, we are still struggling to pick them up, and yet they are the biggest number that struggles. They are the biggest takers of risks on suicidal thoughts, on suicidal rates. There are more men dying from suicide because they are capable of taking the risk, depending on how structured we are. So the biggest factor is still our social cultural norms in society that we are struggling with.
For Pamela Kangwaje, this cause is deeply personal. After battling addiction for over a decade, she now runs Sunflower Meadows Care, offering therapy and hope to others on the same path.
Yeah, diagnosing it was a problem because some would say it was a personality disorder, another person would say it was stress and depression, and another one would say that it was alcohol use disorder. But mostly it navigated more to alcohol use disorder. Even your loved ones will not understand what you're going through because it's unheard of in the African culture that you are facing a problem and you can't manage it and you're going to have a mental breakdown. So today we are giving the community a chance to join us and understand that they are not alone.
Experts recommend engaging in stress-relieving activities like exercise as part of the healing process. These simple routines, they say, can make a big difference.
When you exercise, the happy endorphins come out. And when they come out, if you've had a problem here or there, you will not go back the same. You'll feel much better because of those endorphins.
But beyond awareness, there is an urgent call for action. The executive director of Butabika Hospital warns that Uganda faces a growing crisis: the widespread abuse of drugs and other substances.
We may be getting here because sometimes we lack knowledge of what it is that is going on and where we're getting ourselves. Other times it is maybe circumstances that we are living in, the social, the economic circumstances that we find ourselves in, which is sometimes splitting families apart, that is driving our young people, especially, to develop problems. My call is that we should continue to speak about mental health. Luckily, these days it appears as if many people are thinking about mental health, including our policymakers, and they're driving the agenda, which is very good. Community members are driving the agenda. The lone voices of health workers may not be enough. So when all of us are doing it together, it actually helps, and we need to all push together.
The biggest concern: an overwhelming 85% of Ugandans who need mental health care do not receive it, a statistic that underscores the need for more investment, services, and sustained advocacy. Walter Mwesije, NTV.